My son here has half a heart and I don't know what to do. I can't do anything. I have to sit here and I have to roll with the punches. I gotta listen to the doctors. I have to do what they say and follow their advice and take it one day at a time. As we were walking down the hall, there's some doctors and nurses and there's some gurneys and carts and things like that. And as we get closer, the carts and the doctors and all that stuff start to disappear and they start leaving the room. And all I could see is my 1-week-old son sitting there with his chest wide open, hooked up to about 200 tubes, it seemed.
I just felt like I was constantly crying the entire time and just, I think, trying to grasp what really happened.
To see this little baby under such intensive care, I wouldn't be able to hold him. That was very emotional. That's when it struck me that he actually was it was very serious.
All right, so he has this. What's the outcome? Is he gonna live for 2 more days, or is he going to live for 6 months?
Heart defects are the #1 birth defect in children. More children today die from their heart defects than children die from all childhood cancers. The biggest fear in all of our minds is losing a child, and some people are afraid to say that. Unfortunately, there's too many of us that have been down this road, but you don't have to do it alone.
Hypoplastic left heart syndrome is just prevalent enough that pretty much every cardiologist sees a patient with the disease. It also is the most complex of the heart disease that we take care of.
The surgical results continue to amaze how well we do. But even with the excellent results that we got, what was frustrating was that deaths that occurred unexplained after we did these amazing surgeries, and we didn't really understand it, and we didn't know how to prevent it.
The Board of Pediatrics approached the JCCHD, which is the Joint Council on Congenital Heart Disease. With the Board of Pediatrics, the JCCHD, in January of 2006, came together and made a commitment to develop a quality improvement collaborative for this specialty. It became clear that we should work with children and their families with single ventricle during the first months of life when the morbidity and mortality is so high.
Quality improvement methodology really can, in a rapid and consistent way, improve the care of children with a variety of diseases.
Learning with quality improvement science, it's totally different than what we're taught in medical school. We are actually finding out in this collaborative some answers.
Pediatric cardiology practices have been isolated, and as a result, we don't have data. And without data, you can't make change. Now, what's really great is increasing collaboration between individual institutions.
I think the collaborative has really opened up a new paradigm of cardiology care for pediatric cardiology.
What the collaborative's been able to do is give us structure. Part of what we do is bring together a registry of these kids, track data, we feed it back to teams each month so they can work locally to make the changes.
One of the exciting parts of the collaborative is to see data presented that shows the improvements we've been able to accomplish.
And to be able to meet with people from all over the country and network and come to some consensus on what is sound practice has both sped up the process and made it more accurate.
And it's also been good to see the honesty and see the transparency that has gone on between everybody.
We already had an existing single ventricle program, but participating in the collaborative really opened our eyes to take a step back and evaluate what we're doing.
3 to 5 years ago, it was widely accepted that, oh, this child has a single ventricle, they're just not going to grow. But we don't accept that as even a possibility anymore. So I think that's given the parents hope.
I think we're also helping to standardize the way care is done. Monitoring of kids after discharge is becoming much more frequent. We see impact on a lot of different levels. Families and clinicians are communicating better that not only do we do our work taking care of kids, but part of our role is to improve our work.
Because so much of it, especially at this interstage, is parent dependent, both compliance and understanding, you have to have parents involved, and parents are willing to get involved.
My son here has half a heart. He's been the picture of health. Our cardiologist calls him his rock star. The collaborative is extremely impactful. They're not only are they talking about doing something, they're going back to their hospitals and doing something.
I'm Larry Cable, my wife here, Leanna. We have 8 children. It seemed like each child was a real challenge as they come along. The oldest ones are a big help. And
we have people that come and say, if you want to laugh, you just come to our house.
It's not without its struggles sometimes. You know, we have our difficulties like everyone else.
My OB doctor that diagnosed at 13 weeks that our baby was going to have heart issues. But it was a time of finding peace and comfort in the midst of the struggles of it, because we didn't know if we'd have a baby or not.
There's much reason for hope. You know, that was one thing that we were concerned about. Would he be able to enjoy life? What would it be like for him? We just marvel at all the things we've seen him enjoy. We knew there was a possibility that it might not be that way.
Hearing what we've heard at the collaborative makes us understand what we have and what to be thankful for, and how to try to encourage others to work together.
The involvement of parents in the entire collaborative has been just a life-changing, career-changing experience.
Involvement in the collaborative helps with parents in terms of their ability to understand and cope. The way that we've incorporated parents is not only by bringing them to the learning session, but asking for their input, asking them for their experience.
I'm a great believer in nourishing hope. I think that hope is one of the sources of resilience that we all have in our lives. It's an enormous opportunity to make the extremely rare feel somewhat less rare.
I have been into 2 heart surgery, 1 open heart surgery. I didn't feel any different from any other kid, really. I coach junior high wrestling. I coach a Mason baseball team in the summer. I love sports way too much to stop. And sports aside, I'm trying to become a filmmaker. Health is a very big part of my life, but I think it was at 6th or 7th grade when I figured out there are limitations to what I can and can't do. When I do tell people that, yeah, I have a heart condition, or say I'm at a swimming pool and take my shirt off and they see the scar, they're really surprised that I have it.
The collaborative has been inspirational by helping us to work together, to work with families, and to learn real quality improvement science, all towards the end of improving the lives of these children with serious heart disease.